Hello and welcome to everyone joining the first webinar from the Women's Mental Health Network. My name is Mary Hayes and I'm the Women's Health Policy Officer for the National Women's Council and one of the coordinators of the network. So we're delighted to see such a huge interest in the event, which just shows that women's mental health is a priority for many, especially during and in the aftermath of a global pandemic. So we know that women's well-being has been affected by COVID-19. A recent CSO survey revealed that women's well-being in Ireland is being more adversely affected by the ongoing public health emergency. The percentage of women reporting low satisfaction with overall life is more than double the rate in 2013. So we know that more women than men reported feeling downhearted and depressed in this study. Further data from the CSO has shown that women's caring responsibilities have also increased during COVID-19, and that a quarter of those between the ages of 35 to 44 have reported childcare issues related to the crisis. As National Carers Week comes to a close, it's vital for us to consider how the recovery from COVID-19 can be cognizant of the impact women's increased caring responsibilities during the crisis has had. The National Women's Council received over 1,400 responses to a survey on women's caring responsibilities during COVID-19 and the impact it has had on women's mental health and well-being. So we're currently collating the results and look forward to sharing them all with you soon. We also know that women in marginalised communities, including Traveller and Roma women, LGBTQ+ women, and women who have migrated to or who are seeking asylum in Ireland, will experience additional challenges because a public health emergency amplifies existing inequalities. Pride Month has also just begun, and this year more than ever, it's so important to keep in mind the mental well-being of many LGBTQ+ women, and particularly young women who may not have their usual support networks available to them during lockdown. So today we're delighted to welcome our panelists who will further delve into these issues. So joining the panel today will be Lisa Marmion, Services Development Manager at Safe Ireland, Zoe Hughes, Policy and Research Officer at Care Alliance Ireland, Niamh Grennan, Coordinator of the Dublin Lesbian Line, and Liliana Morales, Psychologist with the HSE Psychology Service for Refugees and Asylum Seekers. So before we kick off, there are just a couple of housekeeping pieces to mention. So for anyone tweeting, please be sure and use the hashtag Women's Mental Health. We're also mindful as we discuss these issues today that many, if not all of us, joining will understandably have experienced some impact to our mental well-being over recent weeks and months to one degree or another. Whether that's been feeling sometimes anxious about ours or others' health, having disturbed sleep perhaps, or finding it harder to concentrate or be as productive at times. We're also conscious, as with at all of our events, that some of the topics we'll be looking at today may be challenging for some, and we'd really encourage everyone to look after themselves in this regard. So we'll be having a 5-minute break, but please do step away from your device whenever you need a little space or a break. You won't need to exit the webinar during the break, you can just leave it open, but if you do accidentally exit, you'll be able to get back in by just clicking the link you received in the email this morning. After the webinar, we'll also be sharing via Twitter links to different mental health supports and helpful sources of information for anyone who may need it. And then finally, your participation is very important to us. So you can use the Q&A function through the webinar below. The questions won't be visible to everyone, but we'll be working in the background to collate the main themes and pose the questions to our speakers during the Q&A. So first, I'd like to welcome Zoe Hughes, Policy and Research Officer at Care Alliance Ireland. So Zoe, if you'd just like to turn on your audio and video. Hi Zoe, welcome.
Thanks very much.
So Zoe, if you'd like to just give us your brief thoughts on how you think COVID has impacted the women that you work with.
Absolutely, and I hope I will be brief. So just to give a little piece of background, my name is Zoe Hughes and I'm the Policy and Research Officer with Care Alliance Ireland. And Care Alliance Ireland is an umbrella organisation in Ireland that works with other non-for-profit groups and NGOs who see supporting family carers in Ireland as some part of their work, either fully or in part. And by family care, what we mean when we say that is actually somebody who is caring for somebody who has a mental health condition, a disability, a long-term health issue, something along those lines. So it's above and beyond sort of what we would call regular family care for children. We focus on macro advocacy, and I use that term kind of in inverted commas. So by that, what I mean is we focus on policy, research, governance, and supporting our 95 plus member organizations that are drawn from across the not-for-profit sector. So just to give a little bit of background, I suppose, on gender and care in Ireland from our perspective in Care Alliance, there are approximately 390,000 family carers in Ireland, and they're split roughly 60-40 female to male. So there are more female family carers than male carers. But when you look at the hours of care, the bulk of care is undertaken, particularly the intensive care, is undertaken by women in the home. There's kind of a bell curve, I guess, of intensity of caring, and also where carers kind of sit on the age and gender spectrum. So it's usually concentrated within females who are between sort of 40 and 60. And very often we use the term sandwich care to describe those. So they're often caring kind of up for their parents who are aging, or other relatives who are aging, and then kind of down in one way for their own children. So those kind of sandwich carers can often feel particularly stressed out and particularly anxious, and particularly they have lots of kind of multiple issues that can impact upon their mental health. As everybody, I think, who's here today will understand, caring has a gendered dimension. And because of that, because of the bulk of care that's undertaken by women, it's broadly devalued in society because of this. But on the flip side, if you were to pay for the replacement cost of care in Ireland that family carers do, so say, for example, if you were to pay for every hour of care that's provided in Ireland by a family carer, it would equate to approximately 10 billion euros a year that's saved by the government, really, in not having to pay for that care in a formalized setting. So just to move on then a little bit to talk about kind of specifically around mental health and family care. In general, family carers usually report higher levels of mental health difficulties during, I guess, the best of times, of which is we're far removed from that now. And that includes much heightened levels of depression, anxiety, issues such as sleep deprivation, isolation, loneliness. So in general, there's a lot more of that experience within the family care community than society at large. But as you can imagine, at the moment, we're hearing a lot of feedback from family carers that we support in some way, to say that it's even more heightened at the moment. It's even more anxious, because if you think about it, all of this isolation is not necessarily new for family carers, but it certainly is new in that they have to be so paranoid and so careful, because a lot of the people who are receiving care are on that highly vulnerable list to the impacts of COVID-19 on their health. So they have to be particularly careful. So we've heard from a lot of family carers who literally have not left their house at all since the beginning of March, which is not healthy. It's not good for anybody, but they're doing that in order to make sure that the people that they care for remain safe. There's actually some recent research that was done by Family Carers Ireland, our colleagues in the sector, specifically around the caring experiences throughout COVID-19. And I just want to highlight a couple of statistics, I guess, that are part of that. 84% of the people who replied to that are wary about getting the virus and not being able to continue care. That's 84% are anxious about that. 60% are worried about the decline in their own mental health during COVID-19, which is really quite a huge number. And 15% feel that they're not coping at all during the pandemic. And so those are just some kind of highlights of that research, which is really quite concerning. Those are very, very high numbers. The withdrawal of supports and services, kind of the face-to-face supports and services such as respite care, such as home care hours, all of those things, some of them have been withdrawn by the providers, and some of them have been withdrawn by the carer themselves. The family carer themselves has made the decision to say, I don't feel safe with a home carer coming into my home. I need to stop that. And therefore their caring burden, even though I hate that term, is so much more because of those decisions that they've had to take in order to keep their family safe. I suppose just quickly before I wrap up, I wanted to talk a little bit about some of the services and supports that are being put in place for family carers that are hoping to mitigate some of that. And it's a very different time for family carers at the moment. So there was a huge, like I said, withdrawal of services. And now there's kind of now a gradual increase, in particularly in online supports, but only where it's appropriate. And that's not going to solve all the problems and all of the anxiety and worry that family carers are experiencing. Within Care Alliance, we actually set up a new Facebook group for family carers quite quickly, and there's a mix there of peer one-to-one supports from family carers to each other, because there's such a huge level of knowledge there within that community, and then professionally moderated support. So my background and my colleague Liam, who work in Care Alliance, we're both social workers by qualification. We also have psychologists, we also have mental health professionals from the HSE. We have various individuals who are in there to provide those supports and to signpost people to where they can get maybe more in-depth supports. Family Carers Ireland, for example, have set up a dedicated counselling line, which has been very helpful, I think, to family carers throughout this whole thing. And obviously then my final point would be, this week is, as I said, National Carers Week, which we in Care Alliance Ireland, we coordinate that every year. And so what we've been trying to do, the theme of this year's week is making caring visible. And although that doesn't necessarily go very far to, solving the very specific support issues that family carers have, by making the issue of caring visible, we hope to actually draw more attention to it and to make it a little bit easier for family carers who are experiencing mental health difficulties to reach out and to know that there are some supports there. They're not as much as they were by half since the pandemic started, but they are kind of gradually coming back. I'll stop there so that I don't keep going over everybody else's time. So I'll just mute myself and turn off my video. So thanks very much.
That's great. Thanks, Zoe. Thanks for your input there and for sharing those supports. I'm sure they'll be very useful to a lot of people who are watching. So next I'd like to welcome in Liliana Morales. Liliana works as a psychologist with the HSE Psychology Service for Refugees and Asylum Seekers. So Liliana, if you'd just like to turn on your camera and audio.
Yeah.
Hi, Liliana.
Hi.
So thanks for joining us. If you'd like to give us your initial thoughts on how COVID has impacted the women that you're working with, please.
Okay, so good morning, everyone, and thank you very much for the invitation. My name is Liliana Morales. I am a psychologist with the HSE Psychology Service for Refugees and Asylum Seekers. This is a service based in Dublin North City and County. That's the CHO9 in the HSE. Before I start talking about our observations of how COVID-19 has impacted our clients, specifically women, I'd like to give also like a brief background on this service. So this service was established in 1992 as a response to the Bosnian refugee crisis. So Ireland brought a group of refugees in 1992, and one of the needs was a psychological need. Over time, the service evolved, and we are now working with asylum seekers and refugees. So most of my work is with people that live in the reception center in Ireland. That is Balsescan Reception Center, located in Finglas. There is a health screening staff, a HSE health screening staff based in Balsescan. There is a psychology service, there is a GP, and there's also a social work service. So we all work together. And we also work very collaboratively with the managers of this reception center. So COVID-19 has really changed a lot of, almost every single thing when it comes to service delivery. Very quickly, we had to adapt the ways we were communicating and linking with our clients. Just to say, one day we were working in the office in the health center, and the next day we were working from home. So very quickly we had to adapt to those changes, use the technology, use phones, use audio links, these kind of online platforms as well, to keep in contact with our clients. So as you know, the HSE kind of faced an unprecedented situation with this COVID-19 crisis, and a lot of people and our own colleagues were redeployed to work in COVID-19 specific services. So we know that a lot of psychology services and other services, like Zoe just mentioned, were basically stopped. Everything was COVID focused, but we were very lucky to be able to continue working with our clients. We were also redeployed, as in we were working with this population in Valsescan, making phone calls in an effort to educate them about the virus. We were giving basic information about how to look after themselves, but we were also giving psychosocial support. So in Valsescan, there is still a public health lead, and we have all been able to work together, very well, the HSE team and the managers. So what are we seeing at the moment in relation to the impact on our clients is that, especially for people that are suffering PTSD symptoms, so in this case would be people that are suffering from very intrusive nightmares, flashbacks, intrusive thoughts, withdrawn, what I call pre-COVID-19, we would have been able to help them link with other services, help them link with other activities that also would support growth and healing, like education, like attending churches, like volunteering. All these things are very, very important when you are dealing with asylum seekers. So unfortunately, COVID-19 came and all the restrictions came, and then people were forced to stay most of the time in the rooms, forced as in because of their own safety. In this case, obviously, usually exercising, practicing social distancing and all of these. So all of these services were cut, and people are finding themselves with a lot of time in their hands, in the room, trying to pass the time, but also, of course, that invites all the sleep disturbance again, all the intrusive thoughts again, all these things that they were able to cope with at the beginning when they were linked with other activities, and now that is not possible. So again, very quickly, we had to devise, for example, a brochure with information about COVID-19 and how to look after your mental health. Also, the HSE put a lot of information in different languages, so we were able to disseminate that. There are a lot of resources online, so there are organizations like the Jesuit Refugee Service who's delivering a wellness session online. But all of these things also have their challenges, because some people came just in the middle of the crisis. Other public service offices were closed. There are difficulties with the PPS number, difficulties with accessing money, difficulties with accessing credit for your phone. So it's been challenging. It's been challenging, and just to wrap up is to say this situation has added more stress to what an asylum seeking experience would be. We are hoping that other services will soon resume as the country is opening up and the phases of going back to some normality are opening up. So I leave it here, and I'll switch off my video and my audio as well.
That's great. Thanks, Liliana. So we were supposed to have Taryn Glavin as part of the panel, but unfortunately she's unable to join us this morning. But we're delighted to welcome Niamh Grennan. Niamh is the coordinator of the Dublin Lesbian line. So Niamh, if you'd like to turn on your audio and video.
Hi, Mary.
Hi, Niamh. Thanks so much for joining. We're delighted to have you here. I suppose for it being Pride Month, where it's so important, I suppose, to have the LGBT voice included in these discussions. So if you'd like to tell me a little bit about the Dublin Lesbian line and your initial thoughts on how COVID has impacted LGBT women in particular.
Absolutely. Thanks so much for having us on. We really appreciate it. I'm going to apologise though, there is some construction happening 2 doors down, so I apologise if there's a bit of noise on the mic. It's everyone working from home, I suppose, is the kind of collateral there. Brilliant. So yeah, so my name is Niamh, and I am the coordinator of Dublin Lesbian Line. So Dublin Lesbian Line has actually been around since 1979, and we've been supporting the LGBTI community since then. We support all women in the community. I know our name sometimes can feel not as inclusive, but it's been around since, 40 years now. We're very proud of the name, very proud of the history. So just to be very clear, we're very inclusive of all women, especially trans and non-binary people as well. So just about the line itself. So we normally run our helpline, it's once a week on a Thursday evening. And we run social inclusion events throughout the year, specifically for women around the country to kind of come together and kind of create that community and that sense of engagement. Unfortunately, at the moment, our office is closed. So where our office is based is in town, and the office itself is actually is quite small, so we couldn't socially distance if we were in there. And we have a policy in place that we never have one volunteer on the line on their own. That's to protect the volunteer themselves, but also to protect the people that are calling. So unfortunately, since lockdown, we have not been operating. But what we've done is we kind of came together as a group and we decided, okay, well, what can we do to kind of engage with the community and to make sure that there's a sense of community still there. So what we decided to do is run a series of webinars. And I feel like everyone's kind of living on Zoom at the minute, but it is actually a great way to kind of have that kind of sense of connection. What we're doing is we're running a webinar series every 2 weeks around different topics. One was on activism, one was kind of looking at like queer representation in the arts. And we had one specifically around self-care and resilience. And then we've done one on like art and journaling. So we kind of just want, something for people to do every 2 weeks. That's kind of a sense of, being part of the community, because a lot of the times that people can't physically get there. We want people to kind of feel like they can kind of be connected with other people. We've definitely seen that kind of isolation and loneliness is the biggest factor that LGBTI women is affecting women's mental health at the minute. Many kind of members of the community kind of have their own coping strategies and have their outlets, and that's, meeting with friends or just being part of different kind of LGBTI social groups, even that's sports groups, or even accessing healthcare, and that's mental health supports as well. At the minute, they can't do that. And that's very frustrating and that's very challenging for people. We know that many young women as well may not be out at home, or they may not be accepted at home. And a lot of people have been forced back into their family home at the minute. And that's incredibly damaging to their mental health, to be able to kind of either kind of go back in the closet or to be there and knowing that people are not accepting them for who they are, and to not be able to go out with mates and be able to go to, whether that's therapy or kind of go to a social group. So there's that kind of, there's a real gap there. Anecdotally, I know that I've been kind of chatting to other LGBT groups around the country and other kind of services, and there's a lot of peer support groups that are being run. Now, a lot of times these would be run maybe in Dublin during the week, and a lot of time I know kind of adult women can't necessarily get to them all the time because they might have other care responsibilities, but we know that the numbers within the peer support groups are actually up at the minute. And that obviously could be because people are struggling and they need more access to mental health supports, or it's actually an accessible thing as well. The fact that they can actually they can't always get into Dublin in the evening time, but now they can actually just get on Zoom. and they can still access those groups. So in a sense, you know, with kind of COVID-19, people are being more creative, people are being kind of resilient in that sense, and kind of go, how can we still access these supports? So I think, you know, from our point of view, definitely we're going to kind of look at more of a blended approach, that we'll kind of do stuff online, but also physically as well. We know that a lot of people access our kind of website and also would ring us to specifically look for an LGBT friendly therapist or counselling service, and that's incredibly important. If you are dealing with sexuality or gender identity, you want to make sure that somebody is supportive and they're also trained in that. And now that everything has kind of gone online, a lot of time people are in their houses and they can't talk openly. They can't, you know, there could be someone in the next room, they could be in shared accommodation, they could be living in direct provision, you know, and you want to be able to kind of have those really honest conversations, but you can't. That's a huge issue, that you can't physically be in a space where you can be really open. When it comes to trans healthcare, I'm definitely not an expert on trans healthcare, but we do work with the trans community. And I know at the minute the gender clinic appointments have been cancelled. I know from March and April they definitely were. I'm not actually sure about June, but I know they're not considered an essential service, which, to be honest, is very damaging, because absolutely, when it comes to trans healthcare, it is so important that, you know, the trans community can actually get, you know, their hormone replacement therapy, or they can actually, you know, get the therapy that they need. And with these online appointments, that doesn't always work for them. Even when it comes to like physically, like self-administering injections, a lot of time people would go to a pharmacist and get it done there, but they're not being allowed to do that at the minute, and that can be quite damaging, because you may not have someone at home that can do that for you. And we absolutely know from statistics that trans people are more likely to experience mental health difficulties. And again, with trans people, that, you know, a lot of the time, if you are at home, you may be forced back into the closet again. You may be, you know, forced to use a different name or, you know, different pronouns, and that's incredibly damaging to mental health. There's also absolutely the issue of, you know, domestic abuse and domestic violence, or even family violence. I know last year Dublin Lesbian Line conducted a survey, and also peer support groups, around domestic abuse, specifically in the LGBT community. And, you know, there was, the statistics that we found was that absolutely it's happening, but people are not talking about it because there's real shame and stigma there. So I think it's really important that we recognise, when we see these figures coming out about domestic abuse, that it's not just opposite sex couples all the time. There's a huge, you know, impact of people losing their jobs and family members getting sick and people not being able to go back to family, and that's incredibly damaging as well to mental health. We know that older people who, you know, may not be in contact with their family, and they might be cocooning, or, you know, they may need that extra bit of help, and they actually may not have it from family members or from their community itself. And also a huge thing for us is accessing local doctors. So if somebody is, you know, has an issue, whether it's a physical thing or a mental thing, that if they don't feel comfortable, whether in their sexuality or gender identity, to access their local GP, things might be missed. And that's really, really damaging. So if they feel comfortable coming up to Dublin and, you know, having a conversation with a doctor, but they may be in a more rural situation where they can't access those facilities, that can be damaging, because in the long run something might be missed. So it's really important that we're kind of accessing LGBT friendly doctors and counsellors. So yeah, that's kind of everything from us for now. I do think it's really important to just recognise there are other helplines that are open. So I know LGBT Ireland at the minute is still open, and they're operating 7 days a week. So thanks so much for having us on. We really appreciate being here.
That's great. Thanks so much, Niamh. Some really complex challenges, I suppose, and intersectional barriers for LGBT women to stay well at the moment.
Absolutely.
So next I'll welcome Lisa Marmion. Lisa is the Services Development Manager at Safe Ireland. So Lisa, hi Lisa. So Lisa, if you could give us your thoughts on how the pandemic is affecting the women that you work with.
I will, Mary, and thank you. Thanks so much for the invitation. I'm delighted to talk to you today about what the UN are terming the shadow pandemic. So a little bit about us. Safe Ireland is the National Social Change Agency working to eradicate domestic abuse and coercive control. So we collaborate with our 39 member services across the country who are providing specialist domestic violence support to women and children. So I just want to talk a little bit first about, pre-COVID-19. So pre-COVID-19, we're already very aware of the established relationship between the experience of coercive control and mental health challenges. So, that's very well established in terms of a bidirectional cause. So experiencing coercive control can create vulnerability to mental health challenges. Experiencing mental health challenges can increase vulnerability to coercive control. So some of the areas of focus there would be, it's 3 times more likely to experience a depressive disorder, 7 times more likely to experience post-traumatic stress disorder, suicide ideations, sleep disorder, eating disorders. So, there's a huge relationship already there. So in order to understand the impacts, we need to really focus on what that experience is like for people and what they're living with right now. So like we talk about coercive control as being a pattern of behaviour that may or may not include physical violence and sexual violence, but it certainly includes 3 equally important interweaving tactics of social isolation, intimidation, and control. So for the women and children that we work with, they're already living with this. And then, we move to the schools closing in mid-March, where children are now home all of the time, which, it does limit the window to reach out a little bit more. And then we move into the 28th of March, where, as we would describe the experience of coercive control as making a woman and child's world stronger, everybody's world, or smaller, everybody's world became smaller at that point. So the ability to reach out was deeply impacted. In terms of the pandemic, we know that during national emergencies, that the reporting of domestic violence, coercive control escalates anyway, and we've seen that reflected in the recent Garda statistics, where they have experienced a 25% increase in reporting. We're also seeing that in other countries. Like, we're still in the throes of it, so it'll be a while before we get clear evidence around what the impact has been. But certainly emerging evidence from Australia is highlighting the increase in severity, the increase in frequency. It's certainly highlighting the increase in complexity. It's also shining a light on the struggles that people have to reach out when their experience is about the micro-regulation of their daily life. So they're a necessary experience of all of our movement being restricted to save lives had, unfortunately, the unintended consequence of uninterrupted control for those who are living with this. Other things that have emerged from internationally have been new reports coming, so new service users coming forward that haven't previously used services. So certainly that resonates with us as well. Creative ways in which services have need to reconfigure in order to reach in, because certainly that's what we've been prompting, is the reach in to those who can't necessarily reach out. The experience as well has been used in a way to, under the guise of restrictions. It's fitted really well with the overall controlling experience, where people have been further isolated from family and friends. So, we see that in the priorities of this issue within Ireland, where TUSLA have named it as one of their top priorities. Operation Fuishiv has been implemented by An Garda Síochána to check back with those who have come to their attention in previous years, to keep those channels of support open. And we would have seen in recent days where that has resulted in the last 2 weeks in May of 107 arrests, prosecutions. You know, the Still Here campaign, very visible on all platforms, reaching into survivors of abuse to let them know that services are still there. The 39 services haven't closed. They've continued to very creatively respond to women and children. Initially, you know, there were, like, it varied across the country, but, you know, initially there were experiences of eerie silences on helplines, but, you know, at this point, as we move, you know, towards and are now in the new normal, there's certainly been huge increases. Some services reporting 40% to 100% increases in contacts. So, you know, we're at a critical point now as we move into the reopening, and that will bring into sharper focus the impacts of this across Ireland. And I suppose really, you know, in the future we'll be looking more towards what the impacts have been. For now, it's certainly it's certainly a time where we need some of these really innovative initiatives to continue beyond the national emergency, where we've seen community engagement really hugely increase. It's very heartening. So that's a general sense of where we're at as those that work directly with women and children experiencing coercive control. So with that, I'll maybe hand you back over to Mary. So thank you, everyone.
Thank you so much, Lisa. So thanks to all our panelists for joining and those of you watching. So we're going to have a short 5-minute break now. So we'll come back at 10:45, we'll say. So remember, you don't need to exit the webinar. You can just leave it open. But if you do accidentally exit it, you can come back in by clicking the link that you received in your email this morning. So after the break, we'll be joined by Louise O'Leary, Advocacy Manager with St. Patrick's Mental Health Services, and a coordinator of the Women's Mental Health Network. And she's going to chair a discussion with our panelists, and we'll also be taking questions from the Q&A function below on your screen. So see you all in 5 minutes.
Okay, welcome back everybody to the second half of our webinar this morning. My name is Louise O'Leary. I'm Advocacy Manager with St. Patrick's Mental Health Services, and along with Mary and Cliona and Elaine, who are working behind the scenes this morning, we coordinate the Women's Mental Health Network. So we're going to move on to the question and answer portion of the webinar. You can contribute any questions you'd like to be asked via the Q&A function for any of the panelists, and we'll try and get to as many questions as we can. I'll just reintroduce everybody, if that's all right, and we'll try and all speak clearly and at a good pace for our very hardworking interpreters this morning. So I'll invite our panelists to unmute and put their videos on so you can see all of us. And just a reminder of who is joining us this morning. We have Lisa Marmion from Safe Ireland, Zoe Hughes from Care Alliance Ireland, Niamh Grennan from the Dublin Lesbian line, and Liliana Morales, who is a psychologist working with asylum seekers and refugees. And I'd just like to acknowledge how difficult it is to speak into a screen without any sense of your audience or any feedback or anything like that. So I think I'm probably representing everybody who's listening to say well done to you all, and we appreciate all the valuable insights you've already shared with us this morning. So just to get started, I might ask you all some individual questions, if that's okay, and we might try and go in reverse order. So I'll come to Lisa first, if that's okay. And thank you so much for really clearly outlining how these spikes we've been seeing, not just in Ireland, but in countries around the world in domestic violence, how the kind of perfect storm of circumstances has contrived to increase domestic violence. We know that within health services, mental health settings are one of the places that are most common for women experiencing domestic violence, to present. And I'm just wondering what you think would be best for anyone who's listening today who works in mental health settings. What's best for services to do to respond to this increase in domestic violence? What they can do to help to respond?
Yes, absolutely, Louise. I suppose when you look at it in terms of inpatient and outpatient, you're talking about 1 in 3 roughly of women who are using mental health services have experienced coercive control. I think really the short answer to that is screening, asking the question, asking directly, creating an environment where disclosure is possible, and really taking any opportunity to ask ask what's going on for someone, because ultimately that will help them connect with the supports that they need. So I'd certainly, I'm a really big fan of targeted and routine inquiry anyway.
Yeah, absolutely. And I think there's been some guidance from the UN as well on health sector responses to domestic violence in COVID-19 in particular. Are there things you'd like to see happening in terms of maybe more substantive changes in how the health services respond or anything like that over the coming months? Or
yeah, well, I know the UN did mention that it's important, particularly at times like this, that health service personnel are trained in recognizing and responding to this, and that the relevant referral pathways are in place. So I mean, that's critical, and again, that's back to us working collaboratively, working together. There isn't one agency that has this. There's not one agency that has the solution. So it's really important that we take the best of ourselves and work together to provide support and change what Leo Varadkar has described it as an epidemic. So it needs to be different here in Ireland. It's very far from where it needs to be.
Absolutely, yeah. Thanks, Lisa, for that. Now I'm struggling to remember if it was Liliana or Niamh in reverse order. I might come to Liliana next, if that's okay. So you can unmute there, Liliana.
Yeah.
So thank you so much for outlining the really challenging circumstances that women have been dealing with, the kind of extra layer of complication with adhering to public health guidance and the restrictions. I want to ask you a couple of things, if that's all right, in terms of, I guess, how the women you've been working with have been dealing with that, or what's that meant for, what's that has meant for them. Are there things that they've been able to use to sort of replace some of those disrupted occupational and social outlets that were so vital to them pre-COVID?
Well, yes. So like I was saying earlier, we had to very quickly gather a lot of information about what other services were putting into place, and things like, for example, find if the churches in Finland, for example, were delivering their masses and that online. So we were able to pass that information on. English classes that were usually on site in Valseskan are now delivered online. So there are a lot of services that are delivering things online over these platforms. But of course, like you were saying earlier, this does not replace the social connection. This does not replace gathering in the same room with people, having a chat, having a cup of tea. So it has somewhat helped, and that's what I was saying. We are hoping that things go back to a little bit more of normality. Same with us. I mean, we are not seeing people face to face just yet. Again, Zoom, attend anywhere, WhatsApp, all of that has been used. We also have a support line in Valseskan where people are able to call, and then we call them back and give them some support. But things are difficult at the moment. The isolation is that previously an asylum seeker would have felt because of the condition, in the country, new in the country. Sometimes they don't speak the language as well. So that would be an extra challenge to be able to link with all of those services that are being delivered in a different way now.
And just to speak to your last point there, we have a question that's come in about how effective services have been since lockdown started, and different people on the panel have mentioned new kind of blended approaches, offering webinars and things like that. Just to stay with you for a moment, Liliana, in terms of, you had a very sudden move to remote working and delivering support and interventions online. How effective has that been from your perspective?
It's been challenging. It's been very challenging, but I think between the end of March and mid-May, because we went back to work from the office, if you like, in mid-May, in the 18th of May, we made over 200 appointments with people. So we did continue working with our clients as much as it was possible. Like I mentioned earlier, we also made those education calls. So when the residents in Valseskan were health screened by the screening team, they would refer to us people that they thought they needed extra support, because of course it is very scary to know that there is a virus out there, and sometimes it's difficult for people to understand, why are you asked to not go out so much, to stay away from people. So we were as effective as we could have been within the circumstances. Like, I can only speak for my service and for the services I'm aware have been delivered in Valseskan, but I do think it's been a very challenging time for everyone, and we had to act very, very quickly and change a lot of things. Like, face-to-face delivery of service cannot be replaced, but it's great that it's 2020 and we can use online services. 20 years ago, this would have been much, much difficult.
Absolutely, I think that's a really important observation. Yeah, and there are limits, obviously, to technology. We've a question that's come in about I was going to direct it to you again, Liliana, but it's a bit unfair, so I might.
Okay.
I'll come back to you later with it about some of the challenges of ensuring empathy and active listening and things like that over remote working, which I think is a great question. We might come back to that, but I'll move on to Niamh now, if that's all right. So Niamh, you were talking about the importance of that social connection and fostering community as a key part of your work. And for you in terms of moving to a blended approach and providing the webinars and things like that, and then I know there's been interest on our Q&A about getting more information on those services. How effective has it been for you, and have you found any of those challenges sort of in terms of communication and things like that using the online forums?
Absolutely, yeah. So like obviously we normally would do the helpline, you know, on a weekly basis. So we will be talking to people and really kind of understanding the issues on the ground. Because we can't do the helpline now, it's, you know, we've moved to the webinar, and we're not interacting with people as we usually do. So we don't get to hear, you know, the kind of challenges and struggles that people are facing. But from our perspective, we want to just do something that we kind of have that sense of connection. So yeah, we've had like great numbers of people kind of logging into the webinars, and we've definitely seen kind of similar names coming up, which is nice to know that people are kind of getting that sense of community and wanting to connect in. But absolutely, there's a huge gap there. You know, I don't think anything can really replace that face-to-face actually meeting with people. But we also do a wellness course that happens on a Monday evening. It's kind of like a self-care resilience course for 6 weeks for women. And that has moved on online as well. I don't facilitate that myself, it's another one of our volunteers. But you're saying it still does work, but it doesn't work in the same sense, because you're in a space, you physically have to go in, you're in a kind of safe space room to actually communicate and talk. But now what you're doing is you're sitting in your bedroom, you know, chatting to a laptop in a sense, and it's still important that that's there. But at the same time, I think we definitely need that kind of blended approach. So because it doesn't always work for everyone, you know, but even like something as simple as a broadband connection, you know, you don't know where you are. You could be somewhere rural and you can't connect to that. You know, as I was saying before, you may not have a private space to do it. So I think we definitely need to look at it in that kind of blended way. But at the same time, actually accessibility wise, it is really opened it up to the whole country. And also, not everyone can afford a train ticket to Dublin, or has the time, or has other care responsibilities. They may have children or someone else they're looking after. They can't always make it, but to be able to log into something. So I do think that it's kind of, the future is definitely the blended, but I think it can't just be online.
Thanks for that, Niamh. Absolutely. So there's opportunities there to increase access, but then there's also the potential that people might be left behind because of availability of devices or digital literacy or those kinds of things. Mm-hmm. And as you said, there's the quality of the social interaction mightn't necessarily be the same, but there's opportunities there as well. Okay, thanks for that.
No worries.
I'll move on to Zoe next. So Zoe, we know it's National Carers Week this week. Hashtag making care visible. Did I get that right?
Okay. You did. Making caring visible, yeah, or any iteration thereof.
Okay, all right. So in terms of yourself and the feedback you've been getting from your members, I'm conscious that some of the services that carers and their family members rely on can't be provided remotely potentially. So that the effectiveness, I imagine, for you of how services have adapted, you may have had a different experience to that in that extent.
Yeah, so it's obviously been a little bit different, because there's kind of, in some ways, there's a few different ways that you can support family carers, and professionals can support family carers. So you have the kind of very practical supports, and it's, in some ways, they're often geared towards help, like supporting the person with a disability or a health condition, but they very much are also helping the family carer have a break, have some time by themselves, you know, maybe lessen their chances of having a back injury if they're, you know, those kind of things. It's never perfect, and there's a lot of family carers who, for example, there's a kind of a rule which means that very often, even if you have a home care worker coming into your house to do some care work with the person that you care for, you're not always allowed leave. You need to be there, even if So it's not necessarily a full break, but obviously family carers aren't even getting that at the moment, or they are maybe in a little bit more minimal, way. So it's been, I think it has been a challenge for a lot of our member organizations. One of the things that we actually put into place we redid our strategic plan actually just last year in Care Alliance, and one of the things we put in as an action was to try and encourage our member organizations who kind of run the gamut of large organizations who, some of their main work is working with family carers, to really small family resource centers across the country who kind of see it as part of their work in the community, but it's not core to their work. To try and encourage online supports being developed for family carers kind of anyway. So that was kind of something that we were interested in as an organization. And this is kind of, in some ways, COVID has kind of sped up that process for us, which has been good in one way because each challenge is forced to do it. But it's been a real challenge for a lot of our members to try and figure out, well, what's the best way that we can actually maybe even not replicate our services for family carers, but just find a way to work and support as many as we can in some way that might be helpful. And we have to remember as well that there's quite a kind of an aging curve in family care, because there's actually quite a lot of older people who are family carers, and they get kind of forgotten about a lot of the time, people in their 70s, 80s, who, at the moment they themselves are maybe caring for their husband or, their wife or whoever it might be, but they themselves are in the vulnerable category and they themselves need extra help, but maybe they're not as used to going online and accessing information and services online. So it's not a kind of a catch-all, so like what Niamh said, like the idea of some blended supports is ideal, but it can't be just one or the other. I think you kind of need to have both.
Sure, thanks for that. And another question for you, Zoe, that actually I might direct to everybody then, so you can get thinking about it while Zoe is put on the spotlight first, is a question that's come in terms of what actions need to be taken at this point, at this phase, as we move to kind of the recovery phase, hopefully, of this public health emergency. What actions do you think need to be taken by government at this time to support the mental health needs of the people you work with or represent?
I think it's again, this is just coming from kind of off the top of my head, but I do think that there needs to be further acknowledgement. For example, we have a policy document called the National Carer Strategy, and it's been around since 2012, and that's kind of the basis of a lot of the policy and kind of supports that are put in place for family carers across the country. And while the mental health of family carers is a key part of that, and supporting the mental health of family carers is a key part of that, it's not one of the ones that has had the best action from government. And so it's one of those ones, it's very difficult to talk about, I think, because for family carers, a lot of the narrative around it is they're wonderful, they're unsung heroes, they're, and there's a massive element of truth to that, but that kind of in some ways places them as a kind of they're amazing, they're fabulous, they don't need, they're just doing this out of the love. And it's like, that doesn't acknowledge that there are needs there. And I do think that the research that's come out of, say, Family Carers Ireland, our colleagues, really highlights that this has been such a worrying time for family carers. It's been exacerbating mental health difficulties maybe that were already there or building before COVID-19, with kind of heightened levels of depression and anxiety anyway, and then all of a sudden this extra thing comes on top of it. So I do think that having access to very specific supports, mental health supports that are available for family carers in particular, but also destigmatizing that, there are difficulties being a family carer. It sucks sometimes. And sometimes you're caring for somebody you mightn't even like, so you have that level of stuff as well. And there's all these other issues that need to be, I think, acknowledged before we can really move on with the supports. That would be kind of a bit of a garbled answer off the top of my head. So please, everybody else come in and make a better answer.
That was far from garbled. That is not an adjective I would use to describe that. That's really interesting what you're saying as well about that narrative of like, aren't they wonderful and those kinds of things. And I've similarly seen a lot of critiques of the superhero narrative that's been, frontline workers have been bombarded with, that, they're human beings and there's limits to what they can do and sustain without there being an impact or a cost.
Yeah.
So I might direct that question to Niamh as well, if that's all right. Now, thanks for that, Zoe.
Yeah, absolutely. I think what we would love to see, and I think it's more of a long-term project, is specifically LGBT training when it comes to mental health support. I know a lot of the time, I was chatting to somebody recently who's trained to be a psychotherapist, and they have one day in their 4-year degree that's about sexuality and gender. And it's like, that's not good enough, you know. I know in the UK they do it a lot better. So yeah, kind of an actual training program in place, and also something to kind of signify that that particular counsellor, therapist, or mental health facility is specifically LGBT friendly. Because unless you see that sign, unless you actually know that, you don't know if you can be open there. You know, so I think it's really important to actually have that signifier. We'd also, like, a huge barrier that we find when people call us is they can't afford it. You know, money is a huge issue. Location absolutely as well, but yeah, either, you know, low cost counselling or just, you know, funded better so that people can actually access it.
Sure, absolutely. So there has to be a funding and a backup to it as well.
Mm-hmm.
You answered a question I was going to ask you about the LGBT friendly therapist, and is that literally you know, how does somebody know? So having that signifier and that sense of something substantive that's been completed to back that up.
It is like actually, it's so important. People don't realize that, you know. I know a friend of mine very recently, she was bringing her little boy in for an operation in a hospital, and she walked in and there was just like a pride flag, and she just goes, it just made me so calm. And so, like, I can actually go, this is my wife, and this is, you know, to be able to actually say that rather than trying to hide and be that secretive, because obviously she was just worried about her child, but actually to walk into an environment knowing that they're accepted there, that is actually huge. And the, you know, the mental health impact in that is really significant.
Absolutely. Yeah, thank you for increasing awareness of that today for us. I might come to Liliana now.
Mm-hmm.
I feel like this question about actions the government can take for the women you work with is, I mean, you could probably talk for the rest of the webinar about this. But in terms of even maybe thinking of the pandemic specifically and kind of the recovery phase, are there priority actions you think need to be taken?
I think in terms of the recovery phase, I mean, both Zoe and Niamh have mentioned that we need more resources. We need more resources to fund more psychosocial supports. This population needs more psychosocial supports in place. We sometimes find that there is a priority in meeting the physical needs of our clients, which is completely understandable. But sometimes psychosocial needs are a little bit overlooked or forgotten. And we know very well from experience, and the research tells us that the psychosocial needs impact on the physical needs and the other way around. So we would like to see more services where people, that people could access. Now, the other narrative is that asylum seekers and refugees can access any service in the country if they are living in the community. So yes, that is true, but then they face the same challenges that people in the community face, with this long waiting lists, difficulty accessing transport to move to outpatient departments or psychology services. Sometimes there are posts for psychologists, social workers that have not filled for a long time. So that adds an extra challenge. When it comes to language as well, sometimes I think we work with 40% of clients that do not speak the language. So we have to use interpreters. And we know it's not the case that in every service our clients access an interpreter is available. So we cannot expect that a person, that just because there is a service in a place, the people can access it if there's those barriers. There's no transport and there's no interpreters. And as Niamh was saying, I think training for people working with asylum seekers and refugees and diversity in general is very, very important. So we know that the psychology courses, the clinical courses, and the counseling courses are making a big effort to include, cultural competencies, working with diversities in their training, but there's still a lot to do, a lot to be done. We as a service have a little bit of input in those courses, but we would like to see more of that. So we have trainees at the moment in the service from the clinical courses in Dublin, and what we're hearing is that it is very important for them to have the experience of working with people that are from a different culture. I think we know from the CSO census in 2016 that 17% of the population that lived in Ireland 4 years ago was not born in Ireland. And it is important to be able to work with people, to have those competencies, to work with people that are not from here. So I would say resources for services and for training, the training of people that are coming after us, and they will work with this population.
Thanks for that, Liliana. And then coming to Lisa, I know you've already outlined some of the elements of the public health response that the government operations FUISHAV and the Still Here campaign. We have a question that's come in that I might just tweak this one for you a little bit. In terms of awareness of domestic violence has increased during the pandemic, and in terms of leveraging that, what is there things that you can do? What can we do, I should say, to ensure the focus maintains on domestic violence and keeps it as a priority after lockdown?
Yes, well, Louise, the profile certainly in my experience of this issue has never been as high. So, there's always that worry when we move on further that it will, go backwards in terms of being, we come into this pandemic with coercive control being the one of the most undetected, unprosecuted experiences that we face as a wider community. So what we really need is for those really positive initiatives to remain. So that very proactive approach by An Garda Síochána, I mean, these are the kind of examples there that will lead to change. There are, of course, some pressing needs, and they very much relate to resources. What was difficult before the pandemic has come into sharper focus. So, as we move towards recovery, and I'm very conscious that we spoke about the importance of that actual contact with people. But in order to achieve that, we need control measures in place. We need suitable spaces. We need adequate staff. So, when people come forward, and they are coming forward, we need to be able to meet that need in a safe way. So, of course, that has resource implications, which again is very in line with what the recommendations are in responding to this pandemic. We've seen it in other countries where there have been, there's been over 200 million specifically for this issue in Australia, for example. The UK, Scotland, significant dedicated budget lines to respond. Because ultimately, when we invest in this issue, we all reap the benefits of that longer term. For our programme of government, like we're always talking about an infrastructure for change. And three of the pillars that we've named, as pressing would be leadership. We've suggested a number of options around that, but certainly a ministerial position would be very welcome. So leadership, housing, housing where there have been, unfortunately, where there have been cracks, during this pandemic, they've become craters. So, services where we were operating less than a third of the recommended refuge provision, that was further reduced then because of the pandemic. So, those kind of experiences need, for example, a whole housing approach. Judicial responses are an area of particular focus as well into the future. But there are key things that we can do to start having a different experience for women and children. And it starts with immediate resourcing. so that we can ensure that when women and children come forward, that we're there in a safe and supportive way. So basically hold on to the really good stuff, because there's been really good stuff. I mean, there's been huge community mobilization, and we felt that as a sector. We felt really supported by the community. There's really fantastic initiatives like the COVID Emergency Fund for those who have been impacted, the Critical Initiative, the Boot Safe Spaces Initiative. There's another couple in the pipeline that I can't just speak about yet, but we will be hearing. So there's some wonderful things that we really need to hold on to, and the wonderful things that have been about working together.
That's really positive to hear. And I think obviously we're trying to increase awareness of the challenges, but equally, if not more important, is about what are the opportunities to actually affect some positive change from this period. So you mentioned there about as one of the positives that's come out of the community mobilization and the potential maybe for new collaborations and cross-sector sort of responses. We have a question that's come in that I'm going to direct to Niamh, if that's all right. In terms of if you find you're working more collaboratively perhaps with other associated services or new services than pre-COVID-19.
Sorry, are you asking, do we find now we are working?
Yeah, exactly. Sorry, yes. So in terms of potential maybe more engagement with community or different organizations or new kind of partnerships or opportunities for collaboration that maybe weren't there before?
Actually, absolutely. So as a community and the different organizations, like I know ourselves, we're completely volunteer run. So we kind of just do it in the evening times. Other LGBT organizations are full time. So there's a real kind of cross section, but because of COVID-19, actually one of the organizations really took the initiative to kind of reach out to everyone and bring us all together. So now we're actually having monthly meetings, all the LGBT organizations in the country, which we've never done before. Which is, it's funny to think, like, why weren't we doing it? Because at the end of the day, we're all after the same goal. We all want to create, you know, a safe, supportive environment to make sure that people are kind of, you know, living their best lives. But it is about pulling those resources together and all that information and that knowledge as well. So yeah, in a sense, it's been really lovely to actually connect with all the different organizations, to kind of see what other people are doing and learn from that as well. So yeah, so hopefully going forward, we actually do collaborate more, and yeah, absolutely, and kind of pull our resources together.
That's great. That's great to hear. And one thing I found really quickly in the mental health sector was the sharing of information and resources, just really quickly, any barriers to getting access to information and things that people were innovating on, those barriers went away. Zoe has a question or an addition there. Fire away.
Yeah, no, it was just an addition to that, actually, because like Niamh said, we've actually found that a lot of organizations, like, kind of collaboration is built into what we do as an umbrella organization. It's kind of baked in, and we feel very strongly about it in our organization. And we found that a lot of other groups are much more open to it now maybe than they had been in the past, you know, so which was really great for us. And also something that I've noticed is that individuals are a lot more, maybe if they're not even tied into a specific organization that we've worked with in the past, are a lot more open to kind of supporting us. So like I said earlier, we created in Care Alliance, our work isn't normally directly working with family carers. That's not something that we do regularly. But we kind of, when COVID kind of hit in a big way, we were really kind of like, we were in a position, because Care Alliance is quite small. It's just myself and my executive director, Liam. That's the organization. And we were able to take advantage of the fact that we're so small and so nimble that we could kind of pivot quite quickly and set up something like a Facebook group. And we actually found, we put out some feelers, and we actually found that within that team now, we have a moderation team in that group. We've over 1,400 family carers who are part of that group now. It grew very, very fast. And it's been fantastic, but the moderation team is made up of myself and Liam. We have 2 social workers from the HSE, from mental health, and also from older persons and geriatric mental health. We have 3 postgraduate students in psychology from UL who volunteered, who kind of, they heard about it and they wanted to volunteer their services, because obviously, you know, they weren't as busy as before. We also have some former family carers. We also have representatives from other organizations who kind of all volunteered and just said, yeah, I'll help. I'll spend some time, you know, making sure everybody's comfortable and, you know, going in and making sure that the diverse skill set that's needed to support family care as well is represented within the moderation team in that group. And so that was something that we've really seen to be really great. So I just kind of wanted to highlight that there's lots of, it's not just organizations, but it's also individuals who, even if their organization that they worked for, or whoever they work for, or maybe they're not working because that's just who they are. They're just like, oh, I'll help. So that's been really fantastic for us.
Thanks for that, Zoe. And I think that reflects back to what Lisa was saying about community mobilisation. And I know Lisa mentioned the Critical Initiative, which is engaging with volunteer services and Safe Ireland and St. Patrick's, which is a really good example of that. I had a question for Liliana I wanted to go back to, but I think she's having some technical difficulties, so hopefully we'll get her back. So while I know we're running out of time, so I just wanted to get one more question in from the Q&A that's been coming in that anyone is welcome to share thoughts on, which is in terms of women with disability finding it difficult to access various supports, and if there are suggestions you have on how we can better reach out for supports, or perhaps awareness you have of initiatives or innovations to do that.
Well, I suppose from our perspective, we work with a lot of disability organizations, and while it's not perfect, it may be useful seeing if there's an organization that can help in some way. There's also a lot of ground up disability, you know, peer-led organizations and individual groups that might be more appropriate. You know, so it depends on the individual. There are supports out there for people with disabilities, but it's not enough. It's not even close to enough. You know, so I'm not going to sugarcoat that. It's not enough. The same as there's not enough supports, I think, for any group that's being talked about on the webinar this morning. I don't know if that's helpful for the person. But because I can see the question here, and because reaching out can leave you more vulnerable. And that's a difficulty that's always the way. You know, when you ask for help, it can definitely leave you a little bit more vulnerable. But I would say that there is stuff out there. Try disability organizations first, and try to see if there's maybe a peer-led disability organization, maybe rather than a top-down one, if that's something you feel that you feel very strongly about, which is absolutely fair.
Thanks for that, Zoe. And I'm just thinking as well about the shift to remote working, and that potentially maybe increases accessibility, but may also pose challenges. So certainly we've moved a lot to, or increased our remote services in St. Patrick's, and it's certainly something I'll bring back that we need to look at and seek feedback from people with disabilities on to see what's working and what's not. So thank you for that question. Liliana is back, and I just wanted to come back to a question that I think's been coming up a few times that people are interested in, which is any tips you might have for any therapists or mental health professionals who are with us today in terms of that therapeutic connection, empathy and active listening when doing remote work.
Okay, I hope my computer doesn't end the connection.
It's working
again.
Good now.
Thanks. Like I said, we had to adapt very quickly to this, and we were not used to work online or on the phone or video calls. I personally found it very tiring at the beginning, and we discovered is because somehow your brain is working harder to try to figure out those, you know, body language cues that you would be able to see when you are working in front of people. So if you're a therapist or a psychologist working over the phone or on these online platforms, lots of self-care. Don't spend the whole day in front of the screen. It's extremely tiring. I think we're all soon fatigued at the moment. So we need to take breaks. We need to explain also to our clients. We do explain to our clients, this is going to be challenging. This is going to be challenging for you. You might not feel that you are connecting with the work at the moment like you used to do before. So if you have any queries, just let us know. It's also as well to explain that if we don't work with them now, they would have to wait because some people don't feel comfortable doing this. But some of them choose to say, okay, if this is what there is at the moment, I'll go ahead with this. But to make them aware that, you know, this is as safe as we can make it. There have been things, you know, you might have heard about Zoom hacking and stuff like that. We are not completely sure if these platforms are safe and secure. We ask them to be in a safe place, in a private place, where nobody's interrupting them. So yeah, I think self-care is a big issue at this point. When I was working from home, I had to make sure that I was standing off, going for a walk, coming back, because you don't realize when you are, for example, like I was in a health center, you walk all day, you're active doing things, but in front of a screen all the time is very tiring and it's very difficult. So when we work with people, we also need to mind ourselves. So self-care tips: sleep well, drink plenty of fluids, take plenty of breaks. And we're lucky that we're able to go out and walk. In some countries that was even forbidden. So go and enjoy the fresh air and come back and then do your next session. But it is important. And let's say the same to the clients. You know, I was saying all the time to my clients, go out for half an hour, enjoy the garden, enjoy the sunshine, go for a walk down the road and come back. Just because it's a pandemic doesn't mean that we have to be in our rooms all the time. And we have to think that asylum seekers live in a room where there's very little space. We might have the luxury of a balcony or a garden. They don't. So we need to encourage a lot of self-care as well.
So much good advice in there, and I think a really nice note to end on for all attendees, whether working in mental health or experiencing mental health difficulties or experience of mental health difficulties in the past, or just interested in the area. I think focusing and supporting our self-care is so vital to sustain. So thank you so much for that. I think we're going to have to wrap up, unless there's any final pressing contributions from any of our wonderful panelists today you'd like to share. No, everyone's staying muted. I think all Liliana's lovely suggestions to go for walks and stretch, and everyone's like, that's what I want to do now. Just a couple of pointers for everyone listening. We will be a reminder that we will be sharing links to mental health supports and information on social media just after this. We'll also be circulating a recording of this webinar to members of the network, and we'll also be sharing information on how you can join the Women's Mental Health Network. If you're not already a member, we'd love you to join. And if anyone has any queries about joining, you can email maryh@nwci.ie. So I'd just like to once again thank our wonderful panelists, Lisa Marmion, Zoe Hughes, Niamh Grennan and Liliana Morales, for all your time today and in the preparations for this. It's not an easy task to do this, so we really appreciate it, and you've given us such valuable insights. I'd also really like to thank all the people working behind the scenes on the webinar, Cliona and Elaine, Mary especially, who's done Trojan work in getting this set up today, the team in NWCI, and Orla and Rachel, who are working in the background here as well, and the rest of the team in St. Patrick's. And I'd really like to thank all of you for joining us today, wherever you are, and wish you all the best for your day ahead.
Thank you.
Bye, everyone.
Thanks, everyone. Thank you.